Hi, this is Alicia Bright. We're going to be talking about Cushing's disease in the context of glucose regulation. Just as an aside, this picture on the first slide is posted by a young woman who wrote an article about what it's like to have Cushing's disease. I posted the link to the article on Moodle. Check it out. So if you remember, the adrenal cortex produces hormones that are known as corticosteroids. You would have gotten this in your pathophysiology class or your anatomy and physiology. So glucocorticoids, if you remember, these are the stress hormones like cortisol. These regulate metabolism. They increase blood sugar so that your body has a lot of energy easily available to fight or flee, that fight or flight response, the sympathetic nervous system. Mineralocorticoids are also secreted in the adrenal glands. These regulate sodium and potassium balance. Aldosterone is something you'll remember from our fluid and electrolyte discussion. Androgens are also released from the adrenal cortex and other places, and these are involved in growth and development and sexual activity. Cushing's syndrome and Cushing's disease. Cushing's disease refers sort of to the endogenous state, and Cushing's syndrome refers to the physiological manifestations of excess corticosteroids. So Cushing's syndrome is caused by an excess of corticosteroids, and the most common cause of this actually is iatrogenic administration, doctor-caused. We prescribe prednisone for people. For instance, remember people with asthma or COPD might be prescribed prednisone, and too much prednisone will cause Cushing's syndrome. Other causes are tumors, basically. Fortunately, 85% of these tumors are located in the pituitary, and it can be actually addressed surgically in a pretty straightforward operation. We'll talk about that in a little bit here. It can also be caused by adrenal tumors or ectopic ACTH production in tumors outside the hypothalamic pituitary adrenal axis. So like lung or pancreatic tumors, this is a pathological displacement of tissue due to metastasis. So what does it look like? Side effects or the effects of excess glucocorticoids include weight gain from accumulation of adipose tissue, hyperglycemia related to glucose intolerance and increased gluconeogenesis, so the liver is stimulated to raise blood sugar levels. Remember, sugar in the blood gives, the physiologic reason for that is so that the body will have energy available for the flight or fight response. This also causes muscle wasting, because remember, if you've got the fight or flight thing going on, you don't have the relax and mend thing going on, the parasympathetic, the thing that helps with digestion and tissue healing and growth. So we also get loss of bone matrix, osteoporosis, causing back pain. Excess glucocorticoids cause loss of collagen. Skin gets really thin and bruises easily. Wounds don't heal well. And there's some psychological manifestations like anxiety, euphoria, and psychosis. This is a picture of Moon Fossey's. You can see her red congestion, the plethora in her cheeks and her forehead and her chin. And this is a picture of the truncal obesity, and this is a picture of striae. You see the stripes on his abdomen are the reddish-purple striae. And then he looks like somebody tried to draw blood from his antecubital fossa over there and left a good bruise on the inside of his left elbow. This slide is just a summary of the different problems that can happen with Cushing's syndrome. So what are we going to do about it? The goal of collaborative care, particularly the medical approach, is we want to normalize hormone secretion. So as we said, there's the iatrogenic cause, which is administration of exogenous corticosteroids. We give drugs that are corticosteroids. Or it might be endogenous or related to a tumor, usually a pituitary tumor. So if it's drug-related, we'll try and wean down those drugs. Of course, if somebody's on those drugs, it's because the asthma or the COPD or other condition is worse than the side effects of the drugs. There's always a trade-off. And so sometimes the doctor and the patient need to make a decision about what's more important. Of course, if it is due to a pituitary tumor, we can treat that. That's treated with surgical removal or irradiation. So, brief review of surgical procedures here. So for Cushing's disease, if it is a tumor, this picture here shows that they could just go in endoscopically. They use an endoscope and they go in through the nose. They go up through the back of the sinuses, and that's the pituitary located right there behind the eyes. And they go in and they just remove that tumor. I used to take care of these patients in the ICU. They'd be in the ICU for only 24 to 48 hours. They'd come out with the sinus packing, so their nose would be really tightly packed with dressings. And we would monitor them for bleeding and for consciousness, level of consciousness, because they did have a little bit of brain surgery. And then we would just treat them as a normal postoperative patient, with the exception of administering corticosteroids. And we would administer these corticosteroids at first in order to stabilize the levels in the body. But the point is to gradually wean them off. Now, if we wean them off too quickly, it results in adrenal insufficiency. You'll understand that a little bit more when we talk about Addison's disease. So adrenal insufficiency is not the same thing as Addison's disease, but there are some similarities, so we'll talk about it a little bit more later. So nursing diagnoses that might be related to somebody who has Cushing's syndrome include risk for infection, obviously, because these people have a high risk of infection due to high blood sugars and thin skin, easily wounded. They may have imbalanced nutrition. They're becoming obese, not because they're eating too much necessarily, but because their dietary needs change because of the metabolic changes associated with hypercortisol. The disturbed body image, of course, refers to the fact that you saw that poster that summarizes all the changes. Well, generally people feel like they're not terribly attractive when they have these changes going on. That can be upsetting for people. Impaired skin integrity is another problem that can happen, obviously, if the skin is very thin and tears easily. It's a problem. So just as a reminder, a nursing diagnosis officially is always in 3 parts. The first part is the NANDA-approved nursing diagnosis, and then we personalize it. So impaired skin integrity would be related to corticosteroid excess, as evidenced by multiple small skin tears on arms and legs, for instance. That's an example. So goals for patient care might include things like patient will experience relief of symptoms, avoid complications, maintain positive self-image, and actively participate in therapeutic plan. These are kind of general all-around goals. But let's drill into that last one. Remember, goals are kind of broad and general. Outcomes are more specific. So if the goal is to actively participate in the therapeutic plan, you can have a list of outcomes that support how you would know if you reached your goal. Well, the outcomes are measurable, right? And so we're going to take those outcomes, and here on the next page, outcome number 1, patient will describe physical changes associated with Cushing's syndrome, is evaluated, remember that important step, evaluated by patient describes physical changes associated with Cushing's syndrome. It's important that a patient understand this so that they don't feel so bad about themselves. They know that this is just part of the disease process and actually that it will resolve once treated. Outcome number 2, patient will list 5 high protein foods to include in a meal plan. Well, number 2, you would evaluate by saying, well, the patient listed beans, tofu, fish, eggs, and chicken. Number 3, patient will discuss the need to avoid exposure to infections, temperature extremes, and emotional stress. An evaluation statement would include that patient explained why it's important to avoid these stressors and described a plan to do so. Wouldn't that be nice? Number 4, patient will correctly describe use of medications as ordered by prescriber. The evaluation statement would sound something like patient lists medications correctly and describes correctly how to use them and when to call the prescriber. So how are we going to care for these patients? We are going to monitor them, first of all, vital signs. Daily weights, remember that daily weights are the best measure of fluid balance from 24-hour period to 24-hour period. We're going to monitor glucose. We'll check blood sugars on these folks. They might even require insulin management. We'll, of course, observe for signs of infection and signs and symptoms of clots, abnormal thromboembolic phenomena. Also, these folks need a lot of emotional support. They may feel very unattractive or unwanted, so we need to be sensitive to that and respectful. And remember, if this is an endogenous problem and they are about to undergo surgery, their symptoms will resolve for the most part when the hormone levels return to normal. So this is a time when you can tell someone, yeah, once we get these things under control, you're going to look more like you used to look. So this is not false reassurance. Remember, therapeutic communication, we don't want to offer false reassurance. But in this case, this is information. When we reduce the level of corticosteroids, you will look more like normal. You will stop having the effects of the hypercortisol situation. So, post-operatively, we're going to have high doses of corticosteroids that are gradually weaned down. And adrenal insufficiency develops if corticosteroid dosage is tapered too rapidly. So signs of hypocortisolism include vomiting, increased weakness, dehydration, or even hypotension. These people can drop their blood pressures because of it. Just as an aside about prednisone, for instance, we will sometimes put people who've had an allergic reaction to something on a prednisone taper. For instance, when I had a bad case of poison oak, I finally got so bad and covered so much of my body and was weeping, and I'm amazed I don't have any scars from it, but finally the doctor put me on a prednisone taper. So I started out on a high dose of prednisone for 3 days, and then gradually over the next week, I would cut the dose in half every day. That's because when you put somebody on this stuff, you don't want to drop it too fast. So that's kind of a classic way of dosing. And oh, by the way, that side effect of euphoria, after 24 hours on high-dose steroids, I was bulletproof. It's amazing how great I felt. And that gradually decreased as the dose of corticosteroids decreased. I can see why people might get a little crazy with this if they're on it all the time. I just had a couple of days on it, but I will never forget the effects. Anyway, when we have somebody with high corticosteroids, we need to taper them slowly. And that's the point of that little diatribe. So now that you know a little bit more about Cushing's, you can look at these pictures. And this is a before and after picture. And the picture on the left is before, and the picture on your right is after. And apparently this young woman, you can see a little bit of moon phases going on and maybe a little bit of acne. And she's got a little bit of that truncal obesity happening. And then look, after she had the pituitary tumor removed, she's still, her face is maybe a little puffy, but you wouldn't really notice unless you were really looking for it. And she slimmed down very well. So the problem with the physical manifestations resolves when the corticosteroid levels in the body are normalized. So that's the goal. And I hope this has been helpful.